C and C also. C means now the index is telling you to refer to some other terms. You will have to go, definitely you will have to go and reference that when it says C. Okay. Whereas when it says C also, it says like you can also go and see there. It is not mandatory. Whereas in a C, you will have to mandatorily, you will have to go and see the other terms which has been referenced there. Whereas in a C also, if this classification does not have the particular listing or condition that you are looking for, then you can very well go to that other term or the reference that it is directing you. Next comes acute and chronic. An acute is an onset of, it is a sudden onset of a disease. So when you have a condition, say an acute appendicitis and a chronic appendicitis, you can report both the conditions, sequence acute and then the chronic. See if you have one code like combo code. So that is called as a combination code. Perhaps if it has a combination code like say appendicitis, acute and chronic, you can report that one code itself. You don't have to report the acute code separately and the chronic code separately. Just report one code itself, which tells you acute on chronic appendicitis or acute on chronic cholecystitis.